Today, I'm going to be speaking to Daniela, so make sure you listen out for what her takeaway is.
Hey, my name's Daniela Bove, and I'm a psychotherapist, and I run a wellbeing and mental health hub in Olney, a little market town in North Bucks. And it has 8 therapists that cover physical health, mental health, spiritual health. The idea is, I used to be a psychotherapist that just worked for myself, and it felt really limiting. So when people would come to see me, I would work on their mental health, but quite often they'd be very tense and tight in their muscles, and they needed massage, or they needed different types of therapy. And so I thought, if I have everything in one place, then it's easier. It's easier, and it makes more sense. It's better for the person.
Wonderful. That sounds incredible. Yeah. Somewhere I'd love to go. So it's mental health, physical health, spiritual health.
That's right. Covering everything, really.
Fantastic. So tell us a little bit about what mental health means to you.
I personally, I can't really divide them. So for me, it's about my well-being, and my mental health is just part of my whole self. So I guess mentally, I would say if my thoughts are overtaking me, or if I can't think clearly, then it affects my physical health, and it affects my spiritual health, and it affects my relationships, and it affects every part of me. So mental health is just all part of a package that is overlooked, I think. And it shouldn't be. It should be up there with going to your GP. So it's as important.
Why do you think that when people are struggling with their thoughts overtaking them, or they're struggling with physical pain, why do you think that the first thought is, let me go book an appointment with my doctor?
I just think it's an old construct, and it's a construct that works very well for some things, but it has its limitations. And part of my job, actually, the local GP surgery do fund me to do a day a week of their therapy, because I think even GPs are starting to realise that they're limited. They're limited in their knowledge, they're limited in their training in terms of mental health and spiritual health. And we do need all three to feel well. So I just think it's an old construct that needs to start we need to start changing the system and the way we view ourselves, and not feel so ashamed that we're feeling anxious, or we're feeling down repeatedly, or we're grieving and we can't cope. And these are really normal human feelings and experiences, and going to the doctor is not going to help that. Well, it might if they direct you to someone else, but the GP themselves aren't trained to cope with that. They're overwhelmed with it, actually. When I speak to the GPs, they're overwhelmed with it. There's so many people now that are going to the doctors for that they need other services to refer to. I think most people, when they go to the doctor, they've reached the end of their tether. They don't know what to do. Or I deal with children and adults, and they take their child, they don't know what to do. They don't know how to make their child feel better, or to leave the house, or to want to go to school, or all these sorts of things. And I think if they knew that there was somewhere they could go for well-being, I think they would access it. I'm just about to, this year, it's a bit of a big endeavour, but I'm going to try and set up a charity, because the other thing I've experienced in the last 2 years of setting up the hub, the well-being hub, is that people can't afford therapy, and that hurts my heart. You know, it's the people that can afford it don't always need it. Some do, but don't always need it. It's a bit of a luxury, and it shouldn't be a luxury. So the people I see through the GP get 8 sessions, and that is quite often just touches the surface. And it's only with me when sometimes they might need some spiritual support, they might need some support with anxiety, they might different sorts of support than I offer, or massage, and they can't afford it. It doesn't seem right.
Do you think we're at a stage where mindset is changing? I've always been a champion of therapy. I went to my first therapist when I was 17. I took myself there because I was a dancer, so I knew that if my body hurts, I go to a physio, and I just instinctively knew I'm going to go. I remember it was £45, and it was Fulham Broadway. Got on a train to London, went there, and I knew that I needed to go. But I found that over the years now, more people are not looking at it like, why are you going to therapy? You're not like some people used to think it was kind of
they did
like, what's wrong with you?
Stigma.
So do you think we're past that now?
We're getting past that. I still think there is a bit of a stigma. I still see a lot of people where not many people in their family know. Their husband might not know they're going. Teenagers often don't want any of their friends knowing they go. So I think it is starting to change, but there's some way to go. And it was the same for me in my 20s when I had a massive breakdown, living in London, chaotic lifestyle. I had no choice but to go to therapy because I couldn't function. So that was my introduction. But yeah, I don't think I didn't tell anyone. I didn't tell anyone I went then. However, I got so much out of it that it was life-changing. Yeah, and then I told everybody. Since then, I still see a therapist, and I will continue to see one forever, I think, because it's such an important part of your well-being. I think there's too much expectation. We can't expect everyone in our lives to fulfill everything we need. We just can't. So if there are people that are trained specialists in not just listening, but we're trained to mirror back. We're trained to support, to nurture, to advise, to actually not advise, but there is some advice in there. It's so important. It is like if you break your leg, you don't think your friend can heal that for you. So if you're grieving, you don't go to your friend and say, I've got a really bad leg, please help me with that. You wouldn't do that. Or even if you sprained your ankle, you might go to a physio. That we do that naturally. And I think if we're really struggling, it's great to have friends. I mean, friends are a massive therapeutic support, I think. But if you're really struggling and it's overwhelming you, that's it. If you feel overwhelmed, or if you feel lost, or if you feel depressed, or you can't go out, or you feel blocked, then getting support just makes sense. Just from somebody who's spent years studying about the brain and the mind and the body and how they all connect, and it makes sense to get support.
Totally. Could you walk us through, if anyone's watching now and they're thinking, this is all ringing true for me, I'm going to go and get some therapy.
Yeah.
Can you just walk us through the process, just so that we can know what to expect? So we ring you, do we, or email you?
Varies for every therapist, this, I think. But the best thing to do is look. It's important. There are lots and lots of therapists out there. It's important to get people that are registered, I think. That's quite important. We've got the internet now. We didn't have that when I first went to therapy, but we have now. And you can tell so much, I think, from somebody's website, their picture, how open their face is, how that relates to you, what they say about themselves and how they practice. So that part's important. But you don't have to tell your whole story in that first session. Absolutely not. It's a gentle introduction to meeting someone and telling them a little bit about why you're there.
What would you say to anybody who's listening now who's thinking, I think I want to give it a try, but I'm scared that I might become dependent, and I'm scared that I can't afford to keep paying for this?
That one's a real concern. I think a good therapist's job is to make sure you don't become dependent on them, to empower you. That's what we're there for. We aren't magicians. You have everything you need already. You just need someone to facilitate you accessing that. So the dependency thing I wouldn't worry too much about, because good therapists won't encourage that. The funding thing is an issue, and that should be discussed. If you're limited with funds, most therapists will do a lower cost rate. Most therapists I know will. And there are charities out there. Mind is an exceptional national charity that offer very low cost, depending on how much you earn, rates. So there are charities out there. There are Young Minds for young people as well. There's usually a youth service in every town that can help young people. So there are services that can see you for a lower cost, but they are usually limited in sessions.
It's Mental Health Week, and we're talking about mental health. There's a lot going on in the world of mental health. When we just say mental health and people have an idea of what mental health is to them, for somebody like you that works in this environment that covers all areas, you're seeing it from every side, every side of mental. Could you just give us a rundown of some of the things that would cover under mental health that we might not even know?
I think stress is probably the biggest one. People experience physical symptoms. So sometimes the GPs refer because they've been testing this person for lots of physical ailments. things like fibromyalgia, chronic fatigue syndrome. These things come up a lot, and they often have a mental health root. So when we block stuff, especially big stuff, trauma, childhood stuff, grief, loss, it can come out physically. So I think probably that's the thing that people won't associate with mental health, that you get physical symptoms if you're blocking emotional stuff. And that I see all the time, I would say, even just in physical tension. That's why massage is so important for those that can have it or want it. The physical tensions and stresses, and then all of the behaviours that go with it. So alcoholism, dysfunctional behaviours that are affecting your life, often, or I would say almost always, have an emotional root. They have a mental health base. So if you want support with an addiction or something that is you keep repeatedly doing and it's affecting your life, therapy is definitely the right way.
I love what you said about the metaphysical side, because I'm a big fan of Louise Hay.
Same.
I shove her book in everybody. And when someone tells me they've got something like, I've got a bad knee, I've got a bad back, I literally go to the symptoms page and look at what thought are you thinking, what problem's been caused. But some people don't really, it's a mixed bag.
True.
I have a book club, and we've started reading it in the book club, and some people would accept some bits and she says take what you want, but I do believe that every single thought you think has to express itself somewhere in your body.
Physically, it does.
It does.
It does. And that, all I would say is that when I'm working with different people, depending on how open they are to that sort of stuff, would determine how I phrase it to them. So I believe that too. Exactly. I believe what you believe with that, but I wouldn't push that idea on someone that wasn't open to that idea. But I would try and explain to them that perhaps some of the energy from the emotion they're blocking has gone somewhere into their system and might be causing tension. Inflammation is a big one for people with emotional problems. So it's just trying to find a way that the person you're with will hear you. And if I gave Louisa Hay to some of my clients, they would look at me like, what the hell is that? But I don't know. I often start the sentence with, I'm bringing my hippie self in now, and all of my clients know that phrase, and they'll chuckle a bit. So even the ones that are a little bit close to that, they'll entertain me, if you know what I mean. But I do like to bring the idea in that we're all connected. That's why we have a holistic therapy centre. You can't divide up mental health, physical health, spiritual health. We are all one thing. They're all connected, and they all interplay with each other. And if you just treat one, then the other two don't get treated. So you have to treat them all. That's why having a place where you can come and get different types of therapy is really important. And have an expert that says, you need a bit of this other therapy now that you may not have heard of, because you need to now work on your soul and your path in life, or you need to work on your physical health. Also, we work with the GPs. They're part of that picture.
Thank you so much. It's been
such a pleasure.
Good speaking to you. I actually want to book myself into your therapy. I want to go in every single section now. That just sounds wonderful.
The clinic is called Rainbow Bridge Holistic Therapy Rooms, based in Olney. The website is www.rainbowbridgeholistic.co.uk. And you can get in touch with all of the 8 therapists through there.
Lovely. Thank you so much. And can you give us a takeaway? I'm asking everyone from today, give us a takeaway. Anyone listening can just take away one thing from what you know that they can use.
Okay, this is a very basic one, but I would say remember your breath. Okay, one of the things that for me anchors me in every single moment, whether I'm feeling angry, sad, distressed, frustrated, is your breath. You can get online, you can find a mindful meditation and just anchor yourself with your breath, deep belly breathing. So if you can Google that and practice some deep breathing, that will I think sort you out in almost any situation. And if by helping yourself you feel like you've done enough and you can't do any more, that's when you get a therapist. Same with the doctor. If you've got a flu and it's not going away, you go to the doctor. And if you've got an emotional problem and you're trying to help yourself and these things aren't working, that's when you go to a therapist. It's the same concept.
Thank you so much. I could talk to you all day. It's been wonderful. You've got so much knowledge, so much experience, and what you're doing is incredible. I'm going to come and visit because you're only in Olney. So you're really close to me. So that's wonderful. Thank you so much.
Lovely to meet you.
Take care. Lovely to meet you.